Good evening. Welcome to Syndrome Differentiation, Pattern Weaving Made Easy, the first of three parts. For the heart and small intestine, we shall discuss the following patterns: heart qi deficiency, heart yang deficiency, sudden collapse of heart yang, heart blood deficiency, heart yin deficiency, hyperactivity of heart fire, blockage of heart vessels, phlegm misting the heart mind, phlegm fire disturbing the mind, and excessive heat in the small intestine. Pattern identification of the Zangfu organs aims to summarize and analyze the clinical signs and symptoms and thus deduce the location of the organs, nature and strength between anti-pathogenic qi and pathogenic factors. This process is based on the physiological functions and pathological features of the Zangfu organs. Since all vital activities and pathological changes are closely associated with the Zangfu organs, the holistic concept of Chinese medicine especially highlights the five Zang organs. The occurrence and development of any medical conditions may eventually affect the Zangfu organs, resulting in their dysfunctions. As a result, this method plays a key role in the pattern identification system. The affected Zangfu organs have to be identified in the final conclusion prior to treatment. To do so, it is extremely important to understand the essential theories of Chinese medicine and be familiar with the physiological functions of the Zangfu organs as well as their connections. Pattern identification of the Zangfu organs includes identification of the Zang organs, Fu organs, and two or more organs. Pattern identification of the Zang organs is particularly important, owing to the internal-external connection between the Zang and Fu organs. Pattern identification of the Fu organs is covered by that of the Zangfu organs. The heart is located within the chest. The heart meridian descends to connect with the small intestine. The two organs are internally, externally connected. The main physiological functions of the heart are to govern blood vessels, store the spirit mind, and dominate the life activity. The heart opens into the tongue. The physiological functions of the small intestine are to separate the clear from the turbid and to absorb the decomposed food. The patterns of the heart can be classified into deficiency and excess. Deficient patterns are often caused by chronic conditions, constitutional deficiency, and anxiety, while excessive patterns are often linked to cold retention, blood stasis, phlegm, and fire disturbance. Common signs and symptoms of the heart conditions include palpitations, chest pain, restlessness, insomnia, dream-disturbed sleep, poor memory, and coma with delirium. The main pathology of the small intestine manifests as excessive heat in the small intestine. These three patterns manifest deficiency of heart yang, qi, hypofunction of the heart, and sudden collapse of yang qi. Over time, heart qi deficiency may develop into heart yang deficiency and sudden collapse of heart yang. The main contributing factors include constitutional deficiency, chronic conditions, and age-related debilitation. Heart qi deficiency causes mild or severe palpitations, chest tightness, and shortness of breath that can be aggravated by physical exertion, sweating, mental fatigue, a pale complexion, a pale tongue with a white coating, and a deficient pulse. Heart yang deficiency further causes cold intolerance, cold limbs, pallor, cardiac pain, a pale and swollen tongue with a white slippery coating, and a faint or irregularly intermittent pulse. A sudden collapse of heart yang may even cause profuse cold sweating, cold limbs, pallor, cyanosis, faint breathing, mental confusion or coma, a pale or dark purple tongue, and an extremely faint pulse. Failure of heart qi to circulate blood may cause mild or severe palpitations, chest tightness, and shortness of breath. Physical exertion consumes qi and thus aggravates the symptoms. Since sweat is the liquid of the heart qi deficiency causes sweating. Failure of qi and blood to ascend to nourish the face and tongue causes a pale complexion and a pale tongue with a white coating. Weakness of heart qi to circulate blood causes a deficient pulse. Over time, heart qi deficiency may impair heart yang, leading to qi stagnation and subsequent cardiac pain. Failure of yang qi to warm the body causes cold intolerance, cold limbs, and pallor. Yang deficiency may produce internal cold, causing a pale swollen tongue and a white slippery tongue coating. Failure of heart yang to circulate blood causes a faint or irregularly intermittent pulse. A sudden collapse of heart yang may cause scattering of Zheng pectoral qi, further leading to faint breathing. Failure of yang qi to consolidate the exterior causes cold, profuse sweating. Failure of yang qi to warm the body causes cold limbs. Failure of yang qi to circulate blood to nourish the body causes pallor, cyanosis of the lips, and an extremely faint pulse. Scattering of qi may disturb the heart-mind, resulting in mental confusion or even coma. The distinctive points of heart qi deficiency include palpitations, shortness of breath, mental fatigue, and general qi deficiency symptoms. In summary, heart qi deficiency involves heart-related symptoms plus qi deficiency symptoms. Heart yang deficiency develops from heart qi deficiency, involving heart-related symptoms plus yang deficiency symptoms. It is distinctively characterized by cold intolerance, cyanosis, and stasis. A sudden collapse of heart yang develops from heart qi deficiency and heart yang deficiency, involving heart-related symptoms plus yang depletion symptoms. It is distinctively characterized by aggravated symptoms of heart qi deficiency and heart yang deficiency coupled with mental confusion or unconsciousness. Common heart-related symptoms of the three patterns are mild or severe palpitations and chest tightness with shortness of breath. Heart qi or yang deficiency can cause worsened symptoms upon physical exertion. A sudden collapse of heart yang can cause life-threatening mental confusion, which requires immediate emergency measures. These two patterns manifest failure of heart yin and heart blood to nourish the heart. The main contributing factors include constitutional deficiency, loss of blood, chronic conditions consuming blood, and internal fire transformed from emotion-induced qi stagnation. Common symptoms of the two patterns are palpitations and insomnia, or dream-disturbed sleep. Heart blood deficiency also causes dizziness, poor memory, pallor or a sallow complexion, pale lips and nails, and a thready weak pulse. Heart yin deficiency also causes tidal fever, night sweats, feverish sensations on the palms, soles and chest, rosy cheeks, a dry throat, a red tongue with a scanty coating, and a thready rapid pulse. Failure of heart yin and heart blood to nourish the heart causes mild or severe palpitations. Failure of yin and blood to nourish the heart mind causes insomnia or dream-disturbed sleep. Failure of blood to nurture the brain causes dizziness and a poor memory. Failure of blood to ascend to nourish the face and tongue causes a pale or sallow complexion and pale lips and nails. Deficiency of heart blood causes a thready pulse. Indeficiency may cause deficient heat, resulting in subsequent feverish sensations on the palms, soles, and chest, tidal fever, and night sweats. Ascending of deficient fire causes rosy cheeks. Failure of yin to ascend causes a dry throat. A red tongue with a scanty coating and a thready rapid pulse are typical signs of internal heat due to yin deficiency. Other than palpitations and insomnia or dream-disturbed sleep, heart yin deficiency is distinctively characterized by a red tongue, a thready rapid pulse, and or night sweats, while heart blood deficiency is distinctively characterized by absence of redness, tongue and cheeks, heat or sweating, but presence of a thready pulse, a pale tongue, and a lusterless complexion. It is easy to identify heart yin deficiency or heart blood deficiency by the heart-related symptoms plus either yin deficiency or blood deficiency symptoms. The heart-related symptoms include mild or severe palpitations, insomnia or dream-disturbed sleep and abnormal mental activities, chest tightness, chest pain, night sweats, profuse sweating, and tongue changes may also be present. However, these symptoms can also be caused by dysfunctions of other Zangfu organs. There is an exception though. Owing to the close association between blood and heart spirit, presence of palpitations and insomnia without other manifestations is often diagnosed as heart blood deficiency. In addition, heart blood deficiency coupled with restlessness, tidal fever, and night sweats can be identified as deficiency of heart yin and blood. Hyperactivity of heart fire manifests an internal exuberance of heart fire. The main contributing factors include internal fire heat, 6 external pathogens, chi stagnation transforming into fire, and over ingestion of hot, spicy, or fatty food. A red face, thirst with a desire to drink water, restlessness, insomnia, dark yellow urine, dry stools, ulcerations, swelling and pain of the tongue, redness on the tip of the tongue, and a rapid pulse. Alternatively, hematemesis, bleeding from the nostrils, bloody urine, mania, or skin sores may also be present. Ascending of exuberant fire causes a red face. Fire consuming fluids causes thirst with a desire to drink water. Internal exuberance of heart fire causes restlessness and insomnia. The heart opens into the tongue. Ascending of fire heat along the meridian may cause redness on the tip of the tongue and subsequent ulceration, swelling, and pain. Dark yellow urine, dry stools, and a rapid pulse are typical signs of interior heat. Additionally, since the heart dominates blood and blood vessels, exuberant heart fire may accelerate the flow of blood, leading to hematemesis, bleeding from the nostrils, or bloody urine. Heat disturbing the mind causes mania. Over time, internal toxic fire causes skin sores. This pattern manifests as excessive fire and should be distinguished from heart yin deficiency, which causes deficient fire. Combined fire and yin deficiency symptoms can be diagnosed as hyperactivity of fire due to heart yin deficiency. The distinctive points of hyperactivity of heart fire include heart-related symptoms, especially involving the mental activities and tongue, redness, ulceration and pain, heat, and excess. Blockage of heart vessels manifests obstructed circulation of heart blood. The main contributing factors include stasis, cold retention, phlegm, and chi stagnation due to aging or chronic conditions. Clinical manifestations: mild or severe palpitations, chest tightness with intermittent chest pain radiating to the shoulder, back, and arms. Stasis causes a stabbing chest pain, a dark purple tongue or a tongue with ecchymosis or petechiae, severe chest tightness, a white greasy tongue coating, and a deep slippery pulse. Phlegm causes an oppressive chest pain, obesity, a general heavy sensation, a white greasy tongue coating, and a deep slippery pulse. Failure of heart yang qi to circulate blood to nourish the heart causes mild or severe palpitations and subsequent blood stasis and phlegm retention. This may further cause chest pain that can radiate to the shoulder, back, and arms along the meridian. Clinically, blockage of heart vessels can be caused by one factor of phlegm, stasis, chi stagnation, and cold retention alone or in combination. This pattern is distinctively characterized by chest tightness and pain. In modern medicine, it can be seen in patients with coronary artery disease, angina, or myocardial infarction. The chest tightness and pain can be caused by trauma, pulmonary or pleural conditions, or mental stress. This pattern is more commonly seen in elderly males, accompanied by Qi deficiency, Yang deficiency, Yin deficiency, blood deficiency, excessive cold or phlegm. The distinctive points of this pattern include intermittent, recurrent chest tightness and pain. Laboratory findings can help confirm the diagnosis and predict prognosis. Phlegm misting the heart-mind manifests turbid phlegm, disturbing the heart-mind. The main contributing factors include internal dampness transforming into phlegm and emotional disturbance. Clinical manifestations: gastric fullness, nausea, phlegm sounds in the throat, mental confusion or unconsciousness, slurred speech, a white greasy tongue coating, and a slippery pulse. Alternatively, mental depression, apathy, dementia expression, muttering to oneself, and abnormal behaviors may also be present. In some cases, a sudden collapse, unconsciousness, phlegm sounds in the throat, salivation, uncontrollable jerking movements of the arms and legs, and a staring spell can be present. This pattern is often seen in a critical stage of depression, epilepsy, or other chronic conditions, such as stroke. Depression causes dementia expression and abnormal behaviors. It often results from emotional disturbance and subsequent liver qi stagnation. Epilepsy causes a sudden collapse with uncontrollable jerking movements of the arms and legs. It is often congenital or linked to a sudden fright. Since the liver dominates tendons and opens into the eyes, internal stirring of liver wind may cause a staring spell. Ascending of liver qi causes phlegm sounds in the throat. External or internal turbid dampness may obstruct the ascending of clean yang and descending of stomach qi, resulting in gastric fullness and nausea. Over time, the turbid dampness may transform into phlegm to disturb the mind, leading to mental confusion, slurred speech, or even loss of consciousness. A white, greasy tongue coating and a slippery pulse are typical signs of internal phlegm turbidity. This pattern should be distinguished from hyperactivity of heart fire. Both may cause abnormal mental activities. However, hyperactivity of heart fire mainly causes excessive heat symptoms, while phlegm misting the heart-mind mainly causes phlegm symptoms, including phlegm sounds in the throat, a white greasy tongue coating, gastric fullness, nausea, and salivation. If coupled with fire heat symptoms, the new pattern can be diagnosed as phlegm fire disturbing the mind. The distinctive points of this pattern include abnormal mental activities due to phlegm disturbing the mind, gastric discomfort and nausea due to ascending of phlegm turbidity, and recurrent attacks. Phlegm fire disturbing the mind manifests phlegm fire affecting the heart-mind. The main contributing factors include internal phlegm fire transformed from qi stagnation and heat phlegm disturbing the mind following an external contraction of heat. Clinical manifestations: red face and eyes, fever, restlessness, manic delirium, yellow sticky sputum, a red tongue with a yellow greasy coating, and a slippery rapid pulse. Alternatively, insomnia, restlessness, dizziness, blurred vision, profuse sputum, and chest tightness may be present. In some cases, illogical speech, crying or laughing with no apparent reason, and manic behaviors may be present. Chi stagnation transforming into fire may consume fluid and form phlegm, which then ascend to disturb the mind, leading to red face and eyes, fever and restlessness. Exuberant heat also causes yellow sticky sputum. Phlegm fire disturbing the heart-mind causes mental confusion and subsequent manic delirium. Internal exuberance of phlegm fire causes a red tongue with a yellow greasy coating and a slippery rapid pulse. This pattern should be distinguished from hyperactivity of heart fire and phlegm misting the heart-mind. Hyperactivity of heart fire is marked by restlessness, insomnia, and dark yellow urine. Phlegm misting the heart-mind is marked by dementia expression, mental confusion, and a white greasy tongue coating. This pattern is marked by mania, mental confusion, and phlegm sounds in the throat. The distinctive points of this pattern include excessive phlegm, exuberant heat, and mental confusion. Excessive heat in the small intestine manifests exuberant interior heat in the small intestine. It is mainly caused by downward transmission of heart fire to the small intestine. Clinical manifestations: restlessness, thirst, mouth or tongue ulcerations, painful urination with a burning sensation in the urethra, bloody urine, a red tongue with a yellow coating, and a rapid pulse. Internal heart fire can disturb the mind and cause restlessness. Fire-consuming fluids causes thirst. Ascending of heart fire causes mouth or tongue ulcerations. Since the heart is externally connected with the small intestine, heart fire can be transmitted down to the small intestine, leading to painful urination with a burning sensation. Exuberant heat damaging yang collaterals causes bloody urine. A red tongue with a yellow coating and a rapid pulse are typical signs of heat. This pattern, also known as downward transmission of heart fire to the small intestine, should be distinguished from damp heat in the urinary bladder. Common symptoms of the two include dark yellow urine with a burning sensation in the urethra. However, this pattern also causes symptoms due to hyperactivity of heart fire, while damp heat in the urinary bladder mainly causes low back pain and lower abdominal distension. The distinctive points of this pattern include symptoms of hyperactivity of heart fire, scanty painful urination with a burning sensation, and an absence of low back pain. We have a table that will make it easy for you to remember the distinctive diagnostic points of each pattern. Heart Qi deficiency, palpitation, shortness of breath, mental fatigue, and general hypofunction. Heart Yang deficiency, Heart Qi deficiency plus deficiency cold symptoms. For sudden collapse of heart yang, you have heart yang deficiency plus yang depletion symptoms. heart-in deficiency, the palpitations and other symptoms plus in deficiency symptoms. Heart blood deficiency, palpitations, etc., plus blood deficiency symptoms. For hyperactivity of heart fire, heart-related symptoms plus heat plus excess syndrome. Blockage of heart vessels, chest tightness plus recurrent attacks plus laboratory tests. Phlegm misting the mind, abnormal mental activities plus ascending turbid phlegm. Phlegm fire disturbing the mind, phlegm plus heat plus mental confusion. And finally, for excessive heat in the small intestine, hyperactive heart fire plus scanty painful urination plus absence of low back pain. For lungs and large intestine, we shall be discussing the following patterns: lung qi deficiency, lung yin deficiency, wind cold binding the lungs, cold attacking the lungs, phlegm dampness obstructing the lungs, wind heat attacking the lungs, heat accumulating in the lungs, damp heat in the large intestine, insufficiency of liquid in the large intestine, and chronic diarrhea due to large intestine deficiency. The lungs reside in the chest. They govern qi and dominate respiration. They also govern dispersing and descending, and regulate the waterway. Externally, the lungs connect with the skin and body hair, and they are externally connected with the large intestine. They open into the nose. The physiological function of the large intestine is to govern transmission and discharge wastes. The main pathologies of the lungs manifest either as a dysfunction of the lungs in governing qi dispersing and descending as well as wei, or as an abnormality of the lungs in regulating the water metabolism. The patterns of the lungs can be classified into deficiency and excess. Deficient patterns include lung qi deficiency and lung yin deficiency. Excessive patterns are often caused by contraction of 6 external pathogens and phlegm dampness obstructing the lungs. The patterns of the large intestine include damp heat retention, insufficiency of liquid, and yang qi deficiency. Common signs and symptoms of the lung conditions include cough, panting or fast breathing, chest tightness or pain, and hemoptysis. Lung qi deficiency manifests weakness of lung qi and hypofunction of the lungs. The main contributing factors include chronic cough, consuming lung qi, lung deficiency due to chronic conditions, and insufficient qi production. Clinical manifestations: weak coughing, panting and shortness of breath that can be aggravated by physical exertion, profuse thin clear sputum, a low voice with reluctance to talk, a pale complexion or pallor and mental fatigue. Alternatively, wind intolerance, spontaneous sweating, and susceptibility to the common cold may be present. The tongue is pale with a white coating. The pulse is deficient. Deficiency of lung qi causes weak coughing, panting, and shortness of breath that can be aggravated by physical exertion. Failure of lung qi to regulate the waterway causes water retention and subsequent clear, thin, profuse phlegm. Weakness of lung qi causes a low voice with reluctance to talk. A pale complexion or pallor, mental fatigue, a pale tongue with a white coating, and a deficient pulse are typical signs of qi deficiency. Failure of lung qi to defend the exterior causes spontaneous sweating, wind intolerance, and resultant susceptibility to the common cold. This pattern should be distinguished from heart qi deficiency. Heart qi deficiency also causes shortness of breath, lack of energy, and sweating. However, it causes mild or severe palpitations and an abnormal pulse as well. In regard to coughing and susceptibility to the common cold, this pattern should be distinguished from wind cold binding the lungs, which involves a short duration and an absence of deficient symptoms. The distinctive points of this pattern are weak coughing and panting, shortness of breath followed by phlegm and spontaneous sweating, and general hypofunction of the body. However, it is necessary to rule out other conditions that may affect the lungs. Lung yin deficiency manifests internal deficient heat due to insufficiency of lung yin. The main contributing factors include chronic coughing damaging yin, tuberculosis or dry heat damaging yin. Clinical manifestations: unproductive coughs or coughing with scanty, sticky sputum, weight loss, feverish sensations on the palms, soles, and chest, night sweats, rosy cheeks, a dry mouth and throat, a dry red tongue, and a thready rapid pulse. Coughing up blood and hoarseness may also be present. Since the lungs like moistening but dislike dryness, lung yin deficiency may produce internal deficient heat to consume fluids and form phlegm, thus resulting in unproductive coughs or coughing with scanty, sticky sputum. Failure of lung yin to nourish the muscles causes weight loss. Failure of lung yin or fluids to ascend causes a dry mouth and throat. Exuberant internal deficient heat causes feverish sensations on the palms, soles, and chest. Ascending of deficient fire causes rosy cheeks. Deficient heat disturbing the yin fluids causes night sweats. Deficient heat damaging lung collaterals causes coughing off of blood. Failure of lung yin to moisten the throat causes a hoarse voice. A dry red tongue and a thready rapid pulse are typical signs of internal heat due to yin deficiency. This pattern should be distinguished from dry heat attacking the lungs. Dry heat attacking the lungs is often acute and is more commonly seen in autumn. It is marked by damage to fluids such as dry nose and throat and unproductive coughs. However, it does not give yin damage signs such as weight loss, rosy cheeks, tidal fever, night sweats, a red tongue, and a thready pulse. The distinctive points of this pattern include an unproductive cough or coughing with scanty sputum, a recurrent extended duration, and yin deficiency symptoms, including weight loss, night sweats, a smaller tongue body, and a thready pulse. For concurrent deficient heat, a red tongue, rosy cheeks, feverish sensations on the palms, soles, and chest, a low-grade fever, and a rapid pulse may also be present. Wind cold binding the lungs manifests external wind cold affecting lung qi. Clinical manifestations: coughing with white, thin sputum, slight cold intolerance, a mild fever, an absence of sweating, a stuffy or runny nose, a white tongue coating, and a floating tight pulse. External wind cold obstructing lung qi causes coughing. Cold is yin in nature, causing white, thin sputum. The lung opens into the nose. Lung qi obstruction causes a stuffy or runny nose. Wind cold binding hui causes slight cold intolerance, a mild fever, and an absence of sweating. A white tongue coating and a floating tight pulse are typical signs of wind cold attacking the exterior. This pattern should be distinguished from a wind cold exterior syndrome and cold attacking the lungs. A wind cold exterior syndrome also results from an external contraction. However, this pattern is especially marked by lung-related symptoms. Cold attacking the lungs mainly causes coughing with profuse sputum, but with no obvious signs of an exterior syndrome. The distinctive points of this pattern include a wind-cold exterior syndrome, lung-related symptoms, and unproductive coughs or coughing with scanty sticky sputum due to binding of lung qi. Cold attacking the lungs manifests cold retention in the lungs. Clinical manifestations: coughing with white, thin, clear sputum, panting, cold limbs, a pale tongue with a white coating and a slow pulse. Cold retention in the lungs blocks yang qi and causes ascending of lung qi, leading to coughing with white, thin, clear sputum and panting. Failure of lung qi to warm the body causes cold limbs. Cold retention impairs the circulation of qi in blood, resulting in a pale tongue with a white coating and a slow pulse. This pattern should be distinguished from wind cold binding the lungs. The distinctive points of this pattern include an excessive cold syndrome, such as cold limbs, a pale tongue with a white coating, a slow pulse, and a white, thin, clear sputum, and lung-related symptoms such as coughing and panting. Phlegm dampness obstructing the lungs manifests accumulated phlegm dampness, impairing the lung system. The main contributing factors include spleen qi deficiency, chronic coughing, or contraction of cold dampness. Clinical manifestations: coughing with profuse, white, sticky sputum, chest tightness, a pale tongue with a white greasy coating, and a slippery pulse. Panting with phlegm sounds in the throat may also be present. External pathogens attacking the lungs may impair the dispersing and descending of lung qi, causing water retention and subsequent phlegm dampness. Failure of spleen qi to transport and transform causes internal phlegm and further affects the lungs. Chronic coughing may also impair the lungs' function in regulating water passage, leading to water retention. All these factors contribute to coughing with profuse, white, sticky sputum. Phlegm dampness may also obstruct flow of lung qi, resulting in chest tightness or even panting with phlegm sounds in the throat. A pale tongue with a white greasy coating and a slippery pulse are typical signs of internal phlegm dampness. This pattern is marked by a chronic duration and profuse sputum. It is worth noting that the critical condition of phlegm dampness may affect the heart as well, leading to concurrent symptoms of heart qi deficiency, heart yang deficiency, or even sudden collapse of heart yang. The distinctive points of this pattern include a recurrent, extended duration of coughing, unlike an acute attack of external pathogens attacking the lungs. Phlegm dampness symptoms, profuse white sticky sputum, phlegm sounds, a greasy tongue coating, and a slippery or wiry pulse, and lung-related symptoms, coughing, panting, and chest tightness. Wind heat attacking the lungs manifests external wind heat impairing way. Clinical manifestations: coughing with yellow thick sputum, fever, slight intolerance of wind cold, a dry mouth with a sore throat, redness on the tip of the tongue with a thin yellow coating and a floating rapid pulse. Wind heat may impair the dispersing and descending of lung qi, causing coughing. Heat is yang in nature and tends to consume fluids, leading to yellow thick sputum. Wind heat attacking wei causes fever and slight intolerance of wind cold. Wind heat consuming fluids may cause a dry mouth with a sore throat. Redness on the tip of the tongue with a thin yellow coating indicates heat in the upper jaw. A floating rapid pulse is a typical sign of wind heat attacking the lungs. This pattern should be distinguished from dryness attacking the lungs and heat accumulating in the lungs. As mentioned in the pattern of lung insufficiency, dry heat attacking the lungs is often acute and is more commonly seen in autumn. Heat accumulating in the lungs manifests interior heat in the lungs. In addition, both wind heat attacking the lungs and dry heat attacking the lungs have a short duration and can cause concurrent symptoms of an exterior syndrome. The distinctive points of this pattern include a wind heat exterior syndrome and lung-related symptoms. Heat accumulating in the lungs manifests internal retention of heat in the lungs. The main contributing factors include contraction of warmth heat or wind cold transforming into heat after attacking the lungs. Clinical manifestations: coughing with yellow thick sputum, panting, fast breathing, a strong fever, thirst, restlessness, nasal flaring, a red tongue with a yellow coating and a rapid pulse. Alternatively, chest pain, coughing up, smelly sputum containing mucus or blood, constipation, and scanty dark yellow urine may also be present. Buildup of heat in the lungs can impair the dispersing and descending of lung qi, causing coughing, panting, and fast breathing. Accumulated heat can consume fluid and thus form phlegm, causing yellow thick sputum. Exuberant interior heat causes a strong fever and thirst. Heat disturbing the mind may cause restlessness. Phlegm heat impairing the airway may cause nasal flaring, indicative of a critical condition. Over time, heat may damage lung collaterals, leading to qi stagnation, blood stasis, and subsequent chest pain and coughing up of smelly sputum containing mucus and blood. Interior heat consuming fluids may cause constipation or scanty dark yellow urine. The distinctive points of this pattern include an excessive interior heat syndrome, from yellow sputum, fever, to coughing up purulent blood and a strong or tidal fever, and lung-related symptoms such as coughing, panting, sputum, nasal flaring, and chest pain. Dryness attacking the lungs manifests pathogenic dryness attacking the lung way, particularly in autumn. Clinical manifestations: unproductive coughs or coughing with scanty, sticky sputum, which may contain blood or may be difficult to expectorate, chest pain, dry skin, lips and nose, fever, slight intolerance of wind cold, red tongue with white or yellow coating, and a rapid pulse. Dryness attacking the lungs may cause unproductive coughs or coughing with scanty, sticky sputum. Dryness may damage the fluid, causing dry skin, lips, and nose. Over time, coughing may damage the lung collaterals, leading to chest pain and coughing up of blood. Dryness attacking whey may cause fever and slight intolerance of wind cold. The severity of fever and chills varies in an exterior syndrome. A warm dryness exterior syndrome is similar to a wind heat exterior syndrome. Dryness damaging fluids may cause a red tongue with a white coating and a floating rapid pulse, while dry heat attacking the lungs may cause a yellow tongue coating and a thready rapid pulse. The distinctive points of this pattern include an acute onset in autumn, symptoms due to damage to fluids such as unproductive coughs, sticky sputum, and dry lips and nose, and lung-related symptoms such as coughing with sputum. In addition, cool dryness may also give concurrent cold signs, while warm dryness may also give heat signs. Damp heat in the large intestine manifests damp heat impairing the functions of the large intestine. The main contributing factors include external contraction of damp heat and an improper diet. Clinical manifestations: abdominal pain, passing of stools containing blood or white mucus, tenesmus or emergent diarrhea mixed with smelly yellow feces, a red tongue with a yellow greasy coating, and a slippery rapid or soft rapid pulse. A sense of incomplete emptying after diarrhea, a burning sensation of the anus, scanty dark yellow urine, fever, and thirst may also be present. Damp heat may obstruct the qi activity of the large intestine, leading to abdominal pain and tenesmus. Over time, damp heat may damage the collaterals, resulting in blood or mucus in the stools. Downward flow of damp heat may cause emergent diarrhea mixed with yellow, smelly feces. Dampness may obstruct the qi activity of the large intestine, causing a sense of incomplete emptying after diarrhea. Heat accumulating in the intestine may cause a burning sensation of the anus and scanty dark yellow urine. Exuberant heat damaging fluids may cause thirst, fever, and smelly, sticky feces. A red tongue with a yellow greasy coating is a typical sign of damp heat. More dampness than heat may cause a soft rapid pulse, while more heat than dampness may cause a slippery rapid pulse. Diarrhea can be caused by either deficiency or excess patterns. Excess patterns are more related to the large intestine, while deficiency patterns are more related to the spleen. There are two excess patterns for diarrhea: damp heat in the large intestine and food injury, which is often associated with the history of binge eating. Deficiency patterns include yang qi deficiency of the large intestine, spleen deficiency, and deficiency of the spleen and kidneys. Diarrhea before dawn. The distinctive points of this pattern include large intestine related symptoms, such as abdominal pain and diarrhea, an excess syndrome with a short duration, and damp heat symptoms, such as yellow greasy tongue coating and smelly or watery feces mixed with blood or mucus. Insufficiency of liquid in the large intestine manifests failure of body fluids to moisten and nourish the large intestine. The main contributing factors include chronic febrile conditions, damaging yin, constitutional yin deficiency, and loss of yin blood after childbirth. Clinical manifestations: difficult passing of dry stools, one bowel movement in several days, a dry mouth and throat, a dry tongue with a dry yellow coating and a thready, hesitant pulse. Alternatively, a foul breath and dizziness may also be present. Failure of fluids to moisten the large intestine may cause difficult passing of dry stools and one bowel movement in several days. Failure of fluids to ascend may cause a dry mouth and throat. Ascending of turbid qi may cause a foul breath and dizziness. Dry heat consuming yin fluids may cause a dry tongue with a dry yellow coating and a thready, hesitant pulse. This pattern is marked by dry stools with insufficient fluids. It should be distinguished from constipation due to qi deficiency, marked by qi deficiency symptoms, blood deficiency, often seen after childbirth or loss of blood, stomach yin deficiency, marked by retching, belching, an increased appetite, and a dark red tongue with a peeled coating, and yang deficiency, often seen in the elderly and marked by strain during bowel movements. The distinctive points of this pattern include difficult passing of dry stools and a dry mouth and throat. It is often seen at the later stages of yin fluid consumption. Chronic diarrhea due to deficiency of the large intestine manifests yang qi deficiency of the large intestine. Persistent diarrhea or dysentery can contribute to this condition. Clinical manifestations: severe diarrhea, fecal incontinence, or even a prolapsed rectum, dull abdominal pain with a preference for pressure and warmth, a pale tongue with a white slippery coating, and a deep, weak pulse. Chronic diarrhea or dysentery may damage yang qi of the large intestine, further causing severe diarrhea, fecal incontinence, or a prolapsed rectum. Yang deficiency may produce internal cold and qi stagnation, further resulting in a dull abdominal pain with a preference for pressure and warmth. A pale tongue with a white slippery coating and a deep weak pulse are typical signs of yang deficiency. The distinctive points of this pattern include chronic diarrhea, not acute, absence of excess symptoms such as a foul breath, a yellow greasy tongue coating, a severe abdominal pain and smelly feces, and presence of fecal incontinence or frequent diarrhea. We have again a table that will make studying the lung and large intestine patterns much easier. Lung qi deficiency will have weak coughing, shortness of breath, and general hypofunction. Lung yin deficiency, common lung-related symptoms plus yin deficiency symptoms. Wind cold binding the lungs, wind cold exterior syndrome plus lung-related symptoms, cold attacking the lung, excess cold syndrome plus lung-related symptoms, phlegm dampness obstructing the lung, recurrent chronic coughing with panting plus phlegm dampness symptoms plus lung-related symptoms, wind heat attacking the lungs, wind heat exterior syndrome plus lung-related symptoms, heat accumulating in the lung, excess interior heat syndrome plus lung-related symptoms, damp heat in the large intestine. We have large intestine-related symptoms plus excess syndrome plus damp heat symptoms, insufficiency of liquid in the large intestine, difficult passing of dry stools plus a dry mouth and throat plus later stages of EN fluid damage. And lastly, we have chronic diarrhea due to deficiency of large intestine, chronic diarrhea plus absence of excess syndrome plus fecal incontinence or frequent diarrhea. Thank you very much for listening. We are now open for the question and answer portion.